I'm presenting about Tardive Dyskinesia Awareness Week. I represent NAMI of Hunterdon County. My name is Shay Dibley. I'm the vice president. And NAMI stands for National Alliance of Mental Illness. And we have advocacy, reducing stigma, and improving the lives of those affected by mental health conditions and their families. While we understand that's our core mission, we are also empowering those with movement disorders, such as tardive dyskinesia, which is a neurological condition of the nervous system after use of psychiatric drugs, which can become problematic for a person's normal daily life. These are the things we're going to look at today as we go through a brief presentation. So we want to talk about TD, tardive dyskinesia. Do you or someone you know have body movements you can't control? Does a family member seem withdrawn? Sometimes they can feel withdrawn if an additional stigma is drawn to them by these uncontrolled body movements. It can affect your mind too, frustration and self-consciousness. But starting a conversation with your healthcare provider is very important. Take the first step. Go to talkabouttd.com/find a specialist for more information on that. So what causes TD? Taking certain medications like antipsychotics or certain medications that treat depression or anxiety, bipolar disorder, are thought to cause a dopamine overactivity and therefore cause some abnormal movements of, on the right, you can see eyes, jaw, lips, tongue, upper limbs, torso, hands, and lower limbs can be affected. This can make a person feel withdrawn and not want to interact with the world around them. We're going to go through a brief slide video about what the effects of tardive dyskinesia are on those who are affected by it. As we see here, these wiggling fingers aren't like just moving your fingers around. They're uncontrolled. Tongue darting, sticking out, or pushing inside of cheek. Examples of the symptoms of the torso, rocking, leaning back, or torso hip shifting. Now, you need to speak with a physician about these because only they can prescribe you and give you the treatment that you most certainly will need. Now, many people have made, now here you see the jaw biting, clenching, side to side movements. Many of these people have made significant progress on their mental health medication treatment plans. But still, because of that, now they have these movement that they can't control and are affecting their day-to-day life. So it's important that you know that there are treatments available, but of course, it's going to be up to you and your physician. Excessive blinking or squinting could be a sign. Again, speak with a specialist. These slide deck has been developed by Neurocrine, which is a biotechnology firm. However, there are other resources available. So educate yourself with your physician. How is TD treated? It goes into a lot of specifics here. This recording will be on our YouTube channel, so you will be able to refer to this or pause it to read this slide deck. Talkabouttd.com/find a specialist will connect you with a local specialist in your area should you not be here in Hunterdon County. However, we do have some resources here too. We're going to talk about it a little bit. Jeff's story. Jeff progressed with his schizophrenia medication, but he had uncontrolled body movements that became persistent, which began to affect his day-to-day activities. So he started a conversation with his neurologist, and his psychologist and neurologist now work together to provide a comprehensive treatment plan for Jeff. Jeff has a story. If you want to go to talkabouttd.com/TD stories, you can watch Jeff's story. Talking points about, we want to talk about TD. Talking points for your appointment with your physician are here. Again, we're not going to go over everything, but you can pause this and look at this yourself and go to talkabouttd.com/guide. There you can find the next page questionnaire that you can use to indicate what things are affecting you or a loved one's day-to-day routine and daily life. So you know, and the physician has a better idea as a starting point, of course. So speak up, start a conversation with your healthcare provider. Online video appointments are available. Doesn't matter where you are, but you can have an online video appointment. As we know, as we have seen in this video presentation, the symptoms of tardive dyskinesia are rarely invisible. So start a conversation. Again, this has been developed by Neurocrine, and today we have Hunterdon Neurology here in Hunterdon County in Annandale. Dr. Varadia and Dr. Pandya in Hunterdon Neurology in Annandale are accepting new patients. If you would like to contact them, they'd be happy to instruct you and get an appointment and a treatment plan that's customized around you or your loved one. Thank you for watching this video. I hope that you have learned a little bit more, and I welcome any questions that you might have at info@namihunterdon.org.